Welcome, everybody. Today, I have the honor to have Dr. Terry Wood here with me. Dr. Terry Wood is a vet who is very special to me, who I have known for, 15 years or a little bit longer? By name, I have only gotten to know him better in the last 8 years. Nevertheless, not 8, it's already 11. Time flies when you're having fun. Why is this a special vet for me? Because he had the honor to work with Dr. Brian McLaren for a few years, and that's over 20 years ago. So first of all, I am going to ask Dr. Terry Wood to present himself to you all. Then I will do the same. Then I will show you a 3-minute video, and then we will be starting with answering the questions. So, Dr. Terry, please go ahead.
Okay, well, I'm Terry Wood. I'm a vet in Mustang, Oklahoma. I used to be a large animal vet. I do mainly small animals now, but of course, I will still do horses with photonic therapy. And I actually took care of the horses for a therapeutic riding program for about 6 or 7 years. And they were all old horses that basically destined for slaughter, 16 to 28 years of age. And 2 of them couldn't even safely ride kids when I got there. But that's all I did was the torch, and they did great. So yeah, we kept them going. I have a lot of fun. I always enjoy treating horses with that, but of course I use it all the time in my practice, before surgeries, after surgeries, all kinds of things.
Thank you so much for sharing that with us. And most of you, I can see the list of the people here present. Most of you know me, but for those of you who don't know me, my name is Eva Servais. I'm from Belgium, and I have been living for more than 22 years now in Spain. I found Dr. Brian McLaren 18 years ago. 2008, 2009 is when I got into connection with Dr. Brian McLaren, and he saved my life. So I am not a vet. I am a vet technician, or a vet, how do you call it? A vet nurse. But when I found Dr. Brian McLaren, I was suffering from fibromyalgia, and Brian was the one who saved my life. Brian was the one who gave me a life worth living again. And that's something I told to Brian back then. And I said, if this works, I need to learn everything about it, because I know so many people in pain. I know so many animals in pain. I want to be able to help them. So it took me less than 5 weeks to be off all my medication. And I wasn't only suffering from fibromyalgia. I also had a broken L4. I broke my back. I was suffering from carpal tunnel syndrome, for which I needed an operation. And Brian just told me, you know what, Eva? 3 sessions, some exercises, and you'll never need an operation. And it's true. I've never been operated for that issue. On top of that, I also was suffering at that moment for chondromalacia rotuliana, or chondromalacia patellar, it's also called, in both knees. I needed prostheses in both knees, and we are so many years later, I still don't have those prostheses. That is also why I dedicated my life in learning everything I could learn about it from Dr. Brian McLaren. Then later on also did some courses in traditional Chinese medicine, and I became a vet tech, and so on. And sadly, Dr. Brian McLaren passed away in 2016. And his son, who was the CEO of the company, asked me to continue his father's life work, which I accepted. So instead of being a lawyer, like I was before, instead of being a jurist, like I was here in Spain, I dedicate my life in helping people for themselves and for their animals to make a world with less pain and less suffering. So that's our introduction, and I know I was a lot longer than Dr. Terry Wood. On the other hand, Dr. Terry Wood is going to be talking a lot more after this little video. So let me share that with you. This is a 3-minute video with 3 short videos of just 1 minute, okay, about some rescue animals who had some significant pain and significant issues, who got a session with the red light on some points and locally. And I know that when you're going to be looking at these videos, you're going to say, I don't believe it. This is not possible. If you have never used it, you probably won't believe it. I do have stamps of the times on those videos, so I can prove to you that this really happens. And this can also happen to your animals, to your pets, when they are in pain, when they're having issues. So let me share this video with you. This is a video of Tommy, a rescue dog that I found outside trembling and in pain. So I don't know what happened. If you look at his skin, you'll see his skin is trembling. If you look at his face, you know he's not well. But I didn't know what was happening. So I gave him a session of the standard points and some specific points. And look at this video. You see him, look at how he's breathing. He's breathing totally calm, and he's lying and sleeping next to the cat. I'm going to stop the video so you can really have a look at the stamps. When I took him inside in the house, it was 9:13 in the morning. I took him inside, I looked at him, I gave him a session, and him sleeping is at 9:29. So this is 16 minutes later. That's how quick a session can work. For the next video is another rescue dog, and this is something that happens to most dogs at least once in their lives. So look at his little toe. He's pulling his leg away because it's hurting. He doesn't want me to touch his toe. He's trying to get in between. You saw the skin here. You see his nail is standing next to his toe. So if I cannot touch him, I know my vet cannot touch it. So if nobody can touch it, I just need to take my torch. So I put the torch, this is the old model. I put my torch on it. I don't do anything else. I just put my torch on it and look at the dog. The dog is not trying to intervene. The dog is already relaxing. Okay, let me just lay down. I'm feeling amazing. That's how quickly it can go. This is another rescue. This is Gypsy. So my house is down there in the back. The sun was coming up behind the mountain. And normally every morning we're walking on this little street. And I saw that she couldn't walk. She was really slow. She has her head low. She's panting. Tail is low. Her back is curved. These are all signs that she's in pain. So I call her just to test her. I ask her to sit down. I ask her to lay down. And I see also with her elbows, she is in pain. So I said, no, you come up. Here you can see all signs of a dog who is in pain. Bald back, head low, panting, all signs of pain. So what do? I always have my torch with me. I torch her. You're not going to believe this. This is the same dog 15 minutes later. Before that, I was just behind that corner. My car is still here. This is the same dog with just one session with red lights on specific acupuncture points. She can lift her leg. She can lift her legs. She's even going to try to jump into my car. Look at her. She's just happy. And this is the strength of what we are talking about. Something that you can do at home yourself. And you see here, so I did go with my dog to the vet. She had an MRI. She had a cervical hernia. That's why she couldn't move her neck. Okay. I also have pictures. You can see them on the Facebook page. I also have pictures where you could see that she had severe arthrosis in her elbows. That's why she was really careful with lying down. And later on, with another MRI, we also discovered that she had thoracolumbar hernias in her back, in her lower back. Now, why do I have so many animals with issues? It's because I have a non-profit. I save abused horses and dogs in Spain. And usually people, when their animals have problems, they don't want to pay for it at the vets, they abandon them, and I am the one who's going to be finding them. So if you look at my YouTube page, you will find a lot more videos with animals who have these issues. And I can only wish that it never happens to your pet. Right now, we are going to go further and we are going to start asking some questions to Dr. Terry Wood. And I am looking here at the list that I already received. Hold on, let me get the list. So, okay, Dr. Terry Woods. As I decided to have this meeting today, in the first place, because of a Facebook group, which is called Dogs with Arthritis, and people really searching for solutions to relieve the pain of their pets, of their dogs with arthritis and arthrosis. My first question to you is, you've treated hundreds, if it's not thousands of animals. First as a regular vet, and then later on as a holistic vet, what are the most consistent improvements you see in dogs with arthritis, arthrosis, or just dogs that are in pain?
Well, I think the big thing is that we can help relieve the symptoms, and we're not going to kill the pet in the process. I was taught if a pet's in pain, give them an NSAID and now gabapentin, and the side effects are really bad, and so I don't even have those in my clinic anymore, not at all. And of course, I'm like a second grader. I always have a good story, but it goes back to when I was a large animal vet 45 years ago. I was called out to do a lameness exam first, and I did my exam. I did just a few months out of vet school, and I thought I did a great job. And the rancher said, "Well, what are you going to do?" And I said, "Oh, we'll put him on 2 weeks of butte, keep him quiet for a few weeks. He'll be fine." And he put his hands on his hips and gave me this look you never want to see when you're all alone out in the middle of nowhere. And he said, "That's all you can do? You're going to try to mask the pain? How many horses have you cured with pain medicine?" Ouch, that hurt. I think I bled a little bit, but I said, "Well, I'm sorry. I just graduated. That's what I was taught to do. That's what I can do." And he said, "Well, if that's all you can do, if that's all the better you can do, go ahead and do it." The horse did do okay, but now it's like, "Hey, ask me again. I can fix it. I'm not going to just mask symptoms." And that's probably the biggest thing is that I see so many pets coming in, with side effects, all kinds of stuff. I talked at a meeting out in the West Coast one time, and a vet from Arizona said, my surgeries, he said, I have to leave the stitches in for 3 weeks because if I take them out before then, it dehisces and, that's no good. And I said, well, are you using, an NSAID and a narcotic tramadol for post-op pain relief? And he goes, how did you know? And I said, well, look, if you just had surgery, would you want to take a drug that made your blood not clot and made you not heal? And he said, that doesn't make any sense, does it? I said, no, it doesn't. So he got a torch, and I called him a month later. I said, how's things going? Oh, it's just like you said, 10 days later, it looks like I did it 3 weeks ago. It's fantastic. So, yeah. So don't want to tell too many stories, but that was a couple.
Yeah, but the story about the stitches, I've heard so many vets doubt it. And I'm just going to tell the story really quick. I had a similar issue with my vet. I had saved a puppy that was hit on the road, and I had the femur broken. And so my vet did the operation, put some metal in it to hold it, for it to get better. And so operation happened on a Friday. 7 days later, I went back to my vet because I saw that there was already pus coming out because the stitches were staying in too long. So when I arrived at my vet got angry with me. He said, Eva, why did you wait so long? I said, excuse me, you told me 10 to 12 days. We're only 7 days now since the operation. He says, that's not possible. I said, please, you operated last Friday. We're Friday today. It's only 7 days. I use my torch every day, okay, surrounding the wound, on my Mode 2 in this case. That I can make those wounds heal a lot quicker. He says, Eva, it is impossible. I said, you record everything in your computer? Just go to your computer. He says, it's impossible. This is one of those vets who, yeah, he has done the studies for veterinarian, and he has learned that it has to be so many days. And if you leave it longer, yes, you can have pus, but 7 days, it's impossible. Well, he came back with a red head, and he didn't talk to me anymore to say, yes, you were right. He had to see the proof that it heals up so much quicker than what regular vets have even seen in their lives. So yeah, stitches, absolutely. But I do want to hear another story of you. I saw a story of you with that little dog was on Previcox or something, and he had arthritis or a problem. Can you tell that story?
Yeah, absolutely. A friend of mine, a veterinarian in a nearby town, he was closing his practice, and he had, we all have our A plus 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 clients, and he said, "Look, you treat this lady right. She's awesome, and treat her dog right." And she said, "It's a little." At that time, it was a 10-year-old, 5.2 pound poodle, and he said, "I've had her on Previcox for several years. She's had a bad back, and you need to keep her on that. You need to." I go, "Okay, great, sure, I'll do that." So the lady comes in and she goes, "Can I get my Previcox script refilled?" I said, "Well, no. Number one, I don't have any, but if I did, I wouldn't give it any." And she said, "Well, my dog's had this back problem." I said, "Well, let's just take care of that." So I started, doing the photonics, and goodness, that was 7 years ago. The dog's 17 and a half now, and she gets around just fine. And excuse me, I'm convinced that had I kept her on the Previcox, I'm sure she would have died, because I've had other vets I've talked with. One of my buddies, I called him for something. And we talked about what I wanted to talk about. And he said, "Look, I've got this 13-year-old golden retriever. She's been on Rimadyl for, oh gosh, 5 years. And it said she's throwing up blood right now, and I think she's going to die." I said, "Well, yeah, you're probably right." But I said, "Look, it's Thursday. It's my afternoon off. Let me come up and I'll treat the dog and we'll do fine." Of course, it went up, stopped the vomiting, stopped the bleeding. And I called him about a week later, and I said, "How's that golden retriever doing?" "Oh, she's doing great. Everything's vomiting stopped, no more bleeding. She's all perky. She's doing great." I said, "Well, good." And he said, "When do you think I should start her back on the Rimadyl?" I went, "No, no, no, no."
Never.
I don't know what he did, but yeah, that's kind of stuff that's happened.
Yeah. I saw another question here. Is APT, so Advanced Photonic Therapy, where we use red light on specific acupuncture points, is it safe to be used alongside conventional treatments like pain medication, anti-inflammatories, or physiotherapy?
Oh, absolutely. There's going to be no interference whatsoever. The only thing is that you're going to find out you're not going to be needing the other stuff. But yeah, you can do it at the same time, and it won't hurt a thing.
Yeah. I see another question. That one makes me smile. After more than 20 years of using APT, so for those who didn't hear it before, Dr. Terry Wood has been working with Dr. Brian McLaren together, because Dr. Brian McLaren used to live a few years in the United States. So Dr. Terry Wood has been doing this for more than 20 years. The question is, after more than 20 years of using APT, what still excites you about this method today?
Well, I think the big thing is just seeing pets that either I see initially or come in as a referral, that I can see that they've been hurt by conventional medicine, and the idea that, okay, let's just go ahead and fix it. Let's not worry about the medication. Let's just go ahead and fix the problem. One of the ladies that works for me has horses, and she and her daughter do drill team with them. And she would mention to me, she said, "Well, my horse has bad hocks, and I took him to the vet, and they've injected him for several years. And, they said that, need to inject the hocks again." And I said, "What?" I said, bring the horse up. We'll treat it." And that was 4 years ago. I treated the horse. I've treated it probably once or twice a year since then, and never had to have the hocks injected. They're doing just fine. And, that's the joy. It's like, I get to do something. I get to fix something. I'm not just going to mask the symptoms. And that's kind of an epiphany that as a veterinarian, as a physician, I think you come to that point. It took me 15 years, and I guess that's about average. You reach the point, can continue to do what I was taught because that meets the standard of care, the legality part of it? Or am I willing to take a step out into faith and try something else to try to actually fix the problem where I don't have to use this? And that's what's exciting to me.
Yeah, absolutely. I would like to know, because I don't remember ever asking you that. You've been using it for over 20 years. What first drew you to this method? How did you get to use this?
It was a free meal and an hour of continuing education. I'll be very truthful. Dr. McLaren sponsored a meeting of our local veterinary association. So I had ulterior motives. Free meal, hour CE, that's great. But, I heard him, and one of my technicians had come with me, and she goes, "Is that guy crazy?" And I go, "Yeah, kind of looks that way," because he talked about all the stuff he'd done and the success he had. And then, the voice inside of me said, wow, if even part of that is true, I need to learn more about it. So that was on a Tuesday evening. And I went up after the meeting and I said, look, I'm closed on Thursday afternoons. Would you come out to the clinic and spend the afternoon and, teach me and let me know? And so he did. He showed up. And of course, I did what I thought was really stupid. I bought my first torch, and my wife's going, "You did what?" And it's like, okay, yeah, just chalk it up. But the very next day, I did a surgery that's normally very bloody and not doing the APT very well. The pet did not bleed at all, during the procedure. And instead of the skin separating so far, it stayed close together. And my tech, who'd been at the meeting, said, "You think that's because of that thing that you got?" And I go, "Yeah, I'm afraid it is, because you know what they usually look like." So yeah, that's how it started. I didn't have really good motives.
Okay. Well, anyways, fact is, it brought something new in your life, which you have been using ever since. So,
Right.
I saw another question. For pet owners who are new to APT, how easy is it to learn and use safely at home? I would like to say something first. For those who know me, they've heard this a lot of times before. But when I get a new client, when somebody writes to me or writes to Advanced Photonic Therapy for help, my standard is the following. I will always say, if I were in your shoes, if we're talking about a serious case, of course, if I were in your shoes, first of all, I would go to a vet who knows about traditional Chinese medicine, who knows about acupuncture points and so on, who is going to do an assessment on your dog. In this case, we're talking about dogs, but can be horses or cats, and who's going to find out what's going on with that animal. That vet will decide which points your animal needs right now, and you will be going back once in a while for a session. And at home, you can keep on stimulating those points with the torch that you can buy. So our goal is not just to say, oh, we're selling here something. No, that's not why we're here today. Because my goal will always be, for animals, go to the vet first. And if it's for a human, go to a human doctor, acupuncturist, who can do an assessment. But to answer then the question, Dr. Terry Wood, how easy is it to learn and use safely at home? How do you do that with your clients?
Yeah, it's real easy to learn. I'll go over the points with them, and of course encourage them to get the flash drives and all that. But I'll go over the points and treat them and show them and just say, relax. If you're upset and nervous, your pet's going to be upset and nervous. This is easy. They're going to feel great. You're going to feel great. I always feel sleepy after I do a treatment, so it gets me too. But yeah, it's real easy. And another point I just thought of, and Dr. McLaren was always adamant about this, because we're talking about dogs in pain and x-rays and all that, is, in a Western line of thinking, it's that if that x-ray looks bad, where that disc is, whatever, that's what's causing the problem, because Western thought says that function follows form. If it looks bad, it must be bad. The Eastern thought, and I tell people, look, I have to take off my Western hat, put on my Eastern hat. The Eastern hat says, I don't care what the x-ray looks like, unless it's really bad. Their feeling is that form, that form follows function. If we can make it work, we don't really care what it looks like. Because I'd read a study years ago where it was some physicians and they took people with back pain and they had different levels of diagnostic imaging and treatment. And they thought that the people that got the higher levels of diagnostic imaging and treatments would have done better. But in reality, they did worse because they were treating stuff that wasn't a problem and actually making it worse rather than helping it. So I think whenever you have a pet, again, traditional veterinary medicine, they're going to show you an x-ray and go, oh my goodness, look at that. That's horrible. But in reality, we look at that and go, okay, well, that might look bad, but the pet's telling me that's not where the problem is. And why don't we just go ahead and make this work, get the pet out of pain, get him working better, and this will probably fix itself. So that's, to me, that's a really big point, because I know a lot of people are bullied into surgeries because they'll go, well, look at those hips, those look horrible, that's awful.
Mm-hmm. Yeah, absolutely. Now, one of the main issues, which even I have felt before, and it's also a question that has come back, it says here, I feel helpless when my dog is in pain. What would you say to these people about what is possible with advanced photonic therapy?
Yeah, when your pet's hurting like that, it's horrible. I had one like that in today. I did the treatment for. Yeah, and of course, you may have to, if there's a time lapse, you may have to use some type of a drug, and that's fine for short term. But yeah, it's just your sign that you need to go ahead and get the pet seen and treated and gone from there. But yeah, that's the most horrible thing in the world, is to see the pets that are hurting, and you do feel very helpless. Let me go shut the door. We got some dogs making noise.
Okay, no problem. And while we are here, I did prepare something. Let me have a look for the people who would like to learn more about, hold on, I'm gonna share it here.
There we go.
Oh, that's awesome. I just now see that the chat wasn't working for everybody. So I've opened the chat. So please send the new messages in the chat now. I'm also already going to share one link for those who are new and want to learn more about red light therapy and advanced photonic therapy. That's a free ebook of 63 pages that you can download for free. That's it's all in there. Dr. Terry, I saw a publication of you in the ebook where, and it's a publication of you from, I don't know, 10 years or 15 years ago, where you said that you had 12, 15, 20 dogs who were clinically dead and that you revived. Could you tell us one of these stories?
Yeah, you talk about stuff you don't want to see, and that's when you're doing a procedure or surgery, and the pet, turns blue or purple, and they're not breathing, and the heart stops. And normally, in years gone by, I would try some CPR, but very unsuccessful. But yeah, I've had quite a number of pets that were actually clinically dead, and I did the Governor Vessel 26 and got them back. And yeah, it's amazing. And the big reason I knew about that is Dr. McLaren told me that he was on a flight from, I think it was Sydney to Brisbane. He said it's about a 4-hour flight. He said about the same from Oklahoma City to New York City. And he said halfway through, there was a call over the intercom that, we've had a passenger in first class collapse. And, if there's a doctor on board, a medico, they could, would somebody please come forward and help this gentleman? And nobody came up, and the messages became more frantic, down to, if you've driven an ambulance, would you please come and help? This man is in trouble. And of course, Dr. McLaren, he always worked on his Okie accent, and I always tried the Aussie accent, but it was like, oh yeah, I'm in third class drinking at barley water. Why should I go help a bloke in first class? So he finally said, better go help him. So he went up there, and he said the guy was dead. He said he had turned color, he had no pulse, and he asked the flight attendant, of course, he reached for his torch, and that was in the baggage, in the belly of the plane. And so he asked the flight attendant to take her fingernail and hit him right there above the lip for 20 seconds. And she said, "I'm not touching him. He's dead." And he said, "Okay." So he reached for his pen, and he took his pen and he started tapping. He said, "Please count to 20 for me." And by 12, the man coughed and sat up. And they gave him some cold lemonade, which he promptly threw up, which he had to treat the points to help calm his tummy down. But yeah, that's what kind of gave me the inspiration. It's like, well, okay, it's not over till it's over. You got to do it. And
Yeah.
unfortunately, I haven't had to do it for a while, but I've done it quite a number of times, and it's awesome.
Yeah. Well, I've done it once in a shop called Aldi here, and there was an old lady who had lost conscience. For those who have never heard about Governance Vessel 26, it's an acupuncture point, and it opens the capillaries to the brain. By opening the capillaries to the brain, more oxygen can get to the brain. So it's a point that you can use on yourself. Well, not if you're in coma. It's not going to help by doing it yourself because you won't know it. But by stimulating that point, opening capillaries to the brain, there is more oxygen that can get to the brain. So it's a point that's being used for in cases of coma, in case you've lost consciousness. And just like Dr. Terry Wood just explained to you, in that case. But I've done it once in a shop because the lady had lost consciousness. She was lying on the floor. They were yelling for help. And although I'm not a doctor, I am not an acupuncturist or a licensed acupuncturist, I always have my torch with me. I always have it with me. It's as simple as that. So her husband was there too. I think they were in their late 70s or early 80s, something like that. So I just said to the man, "Is it okay if I stimulate acupuncture points?" First didn't understand me, so I just repeated it. He says, "Yes, please do anything." You obviously could see that he was in real distress of what was happening to his wife. And so I just took my torch. I put my torch on mode 1. I put it there for a few seconds. And the lady woke up and she immediately tried to sit up, and everybody, "No, don't move, wait till the ambulance is there." But it's magic. And yeah, I've used it on birds. On my YouTube, you can see videos on birds that I have found lying like dead in front of a window or a door. I just put it in there. I've used it on geckos that fell into the pool and that I thought were dead, that had drowned. Use it on them and they wake up again. So it's a point that my students always have to learn as one of the points, that can bring the dead back to living, let's say it this way. Yeah, it's amazing. I'm so happy about that. There's something else we need to talk about, and that is about red light therapy. And I have one of those mats here. Let's see if I can put it on. Yes, this is a red light mat that many people are using. And oh, look at my face. And red light therapy does work. And what we use is a specific red light. Now, why use this? Well, red light therapy is very good. Red light therapy, I'm going to put it aside, otherwise my face is just changing colors. Red light therapy in itself is able to do a lot of good things. It can relieve pain. It can relieve inflammation in the body. It can do many things. But there is a but, there is a but. And that is that red light therapy in itself only works locally. So yes, if my shoulder is hurting or my dog's back is hurting, I can put it on here and it will locally relieve the pain, and it will locally also relieve inflammation and so on. But it's just going to be working there. And I saw a post today about the lady who has a dog and he has torn his ligament. And she wrote, she's in that dog with arthritis in that group, and she says, "Can I use red light therapy?" Yes, absolutely. You can use red light therapy and it will relieve pain and it will help locally. But what Dr. Terry Wood and I and thousands, many thousands of other people and vets, and I have dentists that are using it, and I have acupuncturists that are using it, and so on, is that this simple little red light can do more. On the one hand, we can use it locally to relieve pain, but this, we use it like Dr. Brian McLaren wants it, is we also use it on specific acupuncture points. It's like what Dr. Terry Wood just said, put it on there, it opens capillaries to the brain, more oxygen to the brain, you wake up. If I have pain in my face or in my mouth, I can stimulate large intestine 4 with that light. Just put it on there and I'm going to count till 10. Oh, is it on there? And that will be relieving or helping any problem that I have in my face or mouth. Because large intestine 4 is the master point of your face and mouth. And for that dog who has a torn ligament, yes, local red light is fine. But using a specific red light on stimulation of acupuncture points, we are, for example, going to be stimulating gallbladder 34. I'll put a picture in the replay. I'll put a picture on here so you know where the location is. That's the influential point for tendons and ligaments. So it's going to be working a lot more inside the body, no matter where the problem is. Gallbladder 34 is the influential point for any ligament, any tendon in the body. So in other words, we can stimulate acupuncture points. We can help restore balance in the body, because that's what acupuncture, the stimulation of acupuncture points does. Bringing balance in the body, because any problem that we have, isn't it true, Dr. Terry Wood? Any problem that we have is an issue of an imbalance in our body.
Yeah, that's really interesting. Of course, we're not talking theory here, but the thing that was for me the Rosetta Stone was understanding the Ori clock, the HOARY clock, how that the chi in your body every 8 hours it runs through a cycle, and so 3 times in a 24-hour time span. And if that's working like it should, everything's happy. You're going to be healthy. And that brings up the point on scars, is that many times, I always used to think of the scar as being a very dead, inactive tissue. Well, a scar is actually very active. It's constantly being torn down and replaced, torn down, replaced. And as far as the flow of your life's essence, the chi, it blocks that. So you can have many problems. So if we're treating a dog, a horse, whatever, if there's any scars, we're going to treat that scar to restore the flow of chi. And many times that's maybe the most important thing we do. I know Dr. McLaren said they had a dog in when he was teaching at the University of Queensland, that in Brisbane, that they had an older 13-year-old golden retriever that came in that was having really bad sore hips, and they or whatever the problem was, and they were trying to help it, and nobody could do anything, and the pet was obviously in a lot of pain, and they didn't. It was that. Well, he had learned that, and he thought, well, you know what? I wonder if she's been spayed. So he went to check for a spay scar, and she bit him because that was so sore. And of course, he treated that, and immediately the problem was taken care of. So yeah, it's a whole body thing, not just that. And I've treated horses. It was a father of a lady of a volunteer at the therapeutic riding program, and he was, he didn't believe in any stuff like this, but he had a yearling that had something wrong with his left front leg. And so his daughter finally talked him into bringing it in. He brought the horse in. I looked at it, and of course with horses we can do the diagnostic points. So I did the points, and I said, you might have a hard time believing this, but the reason your yearling is lame on his left front is he's got a sore right hip. I'm going to treat that right hip and everything else, and the horse is going to be fine. And I said, please let me know. We may have to do it another time or two. I didn't hear back, and I thought, oh no, what happened? And I finally saw her. I said, how's your dad's yearling? Oh, he's really impressed. That yearling's doing just fine. So, well, thank you for letting me know. But yeah, and in that case, there was a sore point. I didn't even touch the sore point, but by using the light and specific points and in the horse, letting the horse tell me where the problem was, I could fix it. And that was one of those awesome times.
Yeah. Now, for those people in that Facebook group that I was talking about before, dogs with arthritis, dogs with arthrosis, what would you suggest to those people to do with their animals?
Well, they've got to get them on a good diet. First of all, that's a real problem with many pets, and try to figure out what it is. Do all the standard points, the 12 standard points in the dog, and then try to you can do the sore joint, and don't forget the normal one. Like if somebody's in a cast, they've had knee surgery on the dog or whatever's had surgery on his right knee, it's in a splinter cast, you can't get to it, treat the other one. It'll work that way too. So it's incredible, because with your mat, it's like, well, the mat won't get on there, I can't help it. Yeah, you can. So yeah, do this, and always do the standard points, because I kind of called Dr. McLaren on it one time, because he kind of suffered with a bad back, and he spent a lot of time on the phone. And I said, how good are, because he'd always get upset when somebody was treating a horse and they weren't doing the standard points, they just wanted to treat the sore spot. And I said, well, I won't name names, but when you're on the phone with your sore back, what do you do, all the standard points? Oh no, mate, I just do here and here. Oh really? Yeah, you want that broadcast? But yeah, do the standard points, do the sore joint, do the other one that doesn't hurt, and treat any scars, and that would be awesome.
And what's your, imagine I have a dog with arthritis and I come for the very first time. I'm coming to Mustang, Oklahoma, and I come to visit you with my dog. How does a session look like when I come in for the very first time?
Yeah, well, I'll examine the pet and see what the pet's telling me, and I'll look at any X-rays. Again, with the jaundice eye, I'll look at X-rays and what they've been doing, if they've been on any medication, any problems with it, and then I'll tell them and said, well, what I was taught. Here's what I would do, because that's what I was taught in vet school. But if you want to, go to the dark side, we can offer some alternative treatments here, and we can go ahead and try to help your pet. And so it's up to you, and if if you're looking for the quick pain relief, the NSAIDs and the gabapentin, you're in the wrong place. I'm not going to do that. Number one, I don't have them, but I wouldn't do it if I did have them. But I'll give them options, and there's always some options. And another thing we run into, and and Dr. McLaren kind of, he's like, oh, I don't know if you're right on this, but I also do a lot of work with minerals. And one of the things I try to tell people is that if your pet is in a mineral deficiency, which most everybody is, the body cells are like a little battery, and if they don't have the right minerals in there, that battery's not going to work. And so sometimes, because I'll talk to other veterinarians, I'll talk to the owners, and they said, well, that's crazy, because we did this treatment that should have helped, and it actually had an opposite effect. It made them worse. And I said, well, you're expecting that cell that is mineral deficient to act normally, and it can't, because it doesn't have the right stuff. So if there's any mineral deficiencies, you need to address them, because this is all, and that was the focus of Dr. McLaren, is that it's all about the electronic interactions, and that's what makes it work. So that if we have a pet that has come in that's been on all kinds of treatment, or even the APT, and it's not working, we have to look at, okay, well, the body cells are probably depleted, and we need to help with that. So that's, you don't have to do it on all of them, but you got to keep it in mind.
And you have to remember that everything they may already have received before, and it's leaving toxicity in that body. Yeah, it's just like a question I received today from a client, somebody new who didn't know me, and about dementia and so on, and can the light stop the dementia and so on. And I had to explain that it's not just about the light. It's indeed, it's about nutrition. What are you eating? Where are you living? Is there mold toxicity in the house? I mean, what medication is she taking? What, under what stress? It's not just one little thing that makes you having a problem, or it's not one little thing that can bring the solution to everything.
Right.
And that's also when I see the dog or the horse for the very first time. What horses don't get the same, usually the same food as a dog gets. What I mean, all the dry food. My horses don't eat dry food. It's mountain hay and some alfalfa and the greens that I sow. But when you look at the dogs and what many of them get to eat, because many people also believe what their vets are telling them how to feed their dog, I say, well, for 10 years giving the same food that has been burned, that doesn't really have any quality of nutrition in it, if you keep on giving it, you cannot expect the dog to feel even better just by doing one or the other thing. So I always say we need to look at what your dog is eating. We need to look at the medication that your dog is taking right now. And yes, if you're going to be using advanced photonic therapy, if you're going to be stimulating points, that medication probably, depending on which medication it is, of course. I have a dog with one of the last rescues that I have here has a genetic heart failure. Of course, he's going to get his heart medication. I mean, if we can't replace it because there is an issue there, of course. But no, none of my rescues have had in the last 15 years medication that has any of those names, be it Rimadyl or gabapentin or whatever I'm reading now on the internet, Librela injections and whatever. And so many dogs are dying from these injections and from the consequences. And I've never seen such an amount of dogs with kidney issues, young dogs with kidney issues that we didn't see 20 years ago. It has to come from somewhere. And it just makes me feel sad that there are not so many vets in the United States who are holistic and who can be helping these people and their animals. So, Dr. Terry Wood, tell us, how can people connect with you? How can they find you? How easy is it to find you? Tell us more.
Okay. Well, yeah, my office is in Mustang, Oklahoma. It's in the Oklahoma City metro area. We're about 5 miles west of Will Rogers World Airport. I've got a website. It's terrywooddvm.com, and that's got me emails and all that. And it's got some videos. The TV station had done a video on me treating it, and Naughty the Barrel Horse. That was a great video, which is a problem I solved without learning under Dr. McLaren. I would have been given it viewed and said, well, I sure hope she's better in 2 weeks because I don't know what's going on. But we're easy to get a hold of. And the easiest way to get a hold of me is through an email. It's terry@terrywooddvm.com. Because I always answer that. I go through it several times a day. And, we've had people drive from all over. And I realize that's, but, somebody was really wanting to do it. We could set up an hour consultation. We could go over diet, medicine, and get them, show them how to do the torch and help them with all that. So if somebody wants to do it, like say, I love doing that. That's what keeps you going. It's good stuff.
Yeah, absolutely. So I see the hour is almost up. Whitney has raised her hand. Let's see if I can bring you in, Whitney. Yes, you can talk now, Whitney. I'll ask you to unmute. Yes.
So my question, it's not necessarily generic or treating dogs, but how do we get the word out about this? I've been trying for a couple of years now, and it's just frustrating because I've been using it. I've helped friends use it, and I wish I could do something more. Any ideas?
Well, it's just kind of word of mouth because so many people, and I was one of those. I thought that it was voodoo, witchcraft, you
Yep.
know, something like that help. But I think it's just like the churches has the same problem. How can we get people to come to church? And it's one on one. You could spend fortunes on mass advertising, and it's not going to be effective. But people, like with me, it's people I treat. And, I've been here long enough now that we get a lot of people. It's like, well, I've heard about you do that red light. Can you help my pet? And I think that's how you have to do it, is just, you have to be patient, which is the hardest thing for me in the world to do.
Right.
Just have to be patient, keep doing the right things, and have people, share it with people. And I think that's the best way, because you have trusted friends that people, if they heard it, they go, well, that's ridiculous. But if a trusted friend says, hey, this is what I'm doing, this is, you've seen the difference in me, you've seen the difference in my pet. We have that all the time, where people walk their pets in the park and people come in and go, everybody's noticed how much better my dog's doing. Everybody says, hey, your dog's doing so much better. What did you do? And that's how you have to do it. It's just, one person at a time.
Got it. Thanks.
Awesome. Thank you so much, Whitney. And by the way, the chat is open now. I see Inbel. I would love to hear more about the minerals. How do you check if there is any deficiency, and how do you get the supplements your dog need? Well, Dr. Terry Wood, maybe we can also organize another meeting to talk more about minerals and supplements.
Yeah.
But you can already answer Inbel now, but I would suggest that in our next meeting in January, we spend more time on this too.
Yes. Yeah. Well, one real easy one that I do all the time is with thyroid function, because, anybody who's had their thyroid removed will tell you, I'll tell people, it's like, well, it mainly, you see it with the skin and hair coat, but it affects everything in the body. It's like, well, you're not telling me anything new. I had my thyroid out and they didn't give me any supplements. Man, that was awful till they got me on it. So, we see that a lot in dogs for whatever reason. And just because you don't have a goiter doesn't mean you're short on iodine. So very simply, I'll take some tincture of iodine you buy at the store, put it on the inside of the ear. That's usually on a pet, the way to see it. It should stay there for 12 hours. If it fades in at all before 12 hours, that means that the thyroid gland is starving to death if it soaks it up like a dry sponge soaking up water. And then, of course, it's a whole different subject on minerals, because so many of the minerals are in a state that your body can't really absorb, but we have access to some that are. But that's an easy one you can test, and I see lots and lots and lots of problems with that, because as you heard me coughing, the freeze still hasn't killed the ragweed here, so I'm still enjoying the ragweed. But a lot of pets have allergies and skin issues and hair issues, and if we see a pet that has a hard time losing weight, they're losing their hair, the hair's washed out. First thing you think about is, well, my goodness, that thyroid gland is not working. And so we can put that on there, real simple, rather than spending, $500 on the thyroid tests. So that's just one thing we can do.
Yeah, absolutely. And by the way, on my website with the blogs, with the blog articles, you will find an article about the iodine. I shared that, and to do on a human, 2 by 2 centimeters. We say it in English. No, in Europe we use centimeters. Okay, 2 by 2. See how quickly it goes away, and just renew. And I did that together with the daughter of my vet who has thyroid problems, and we put it on together. And within an hour, it was already gone on her arm. And we were both looking like, how is this possible? I still have the mark. I didn't have an issue. I still have the mark. And with her, you just saw it disappear. So I talk more about that in one of the blogs on the website, if you want to know more about that. I see Kim. Kim is asking, if my dog is on pain medicine, can I start the therapy while my dog gets off the medicine? Both back legs are too sore to stand.
Yeah, absolutely. Yeah, you don't want to just immediately just stop the medication. Your pet's going to be in agony if you do that. So yeah, I would start the APT and then just gradually with the velvet hammer reduce the dose to keep the pet comfortable. Absolutely, because yeah, you don't want to stop. I've had several pets with various medications. Like, look, we need to do 8 weeks to cycle your pet off this. They come in the next week for a recheck. Well, I took him off that just like you said. He's doing just fine. And I go, no, that's not what I said.
Yeah, absolutely.
It
when
can.
when I met Dr. Brian McLaren, well, through the emails, that's the first thing he said. Eva, start torching your points and just keep on taking your medication. So I got medication before Dr. Brian McLaren because of my fibromyalgia, because of all the pain and problems I was having. You know, there's a book on fibromyalgia that says the 100 symptoms and syndromes of fibromyalgia, and I was positive for 99. So you can imagine what a disaster I was before Advanced Photonic Therapy. And I just started doing the points every 2 days. Some points locally I did every day. The other points, it was just every 2 days. And I discovered that I was getting better because in regard to my fibromyalgia is because suddenly I was able to work more than 2 hours in the morning. Suddenly I was working 3 hours and 4 hours and I could keep going. And then one day I came in and I saw that I forgot to take my painkillers that I was receiving. And that's when I said, oh my God, this is working. And this is how in 5 weeks I got off all my medication that I was taking. And I've been medication free for 17 years now. I've never ever taken anything for my fibromyalgia or my problem in my knees. Yes, I've had some injections. Why? Because I live in a ranch and sometimes I would step in a nail that has some rust in it, or I would get a bacterial infection. And then, yes, they have to inject something to me in hospital. A bacterial infection, yes. But other than that, no, for pain or headaches or intestinal indigestion or whatever problem it can be. It's just my torch. That's why I have it with me at all times, to help myself and to help others. So no, never simply stop. That's my first rule that's why I always ask people first, what are you taking right now? Because every medication that you've taken has also left something in your body. So often I will talk to people about detoxing your animal or even detoxing yourself. I even do it for myself. Katinka is asking, let me translate that. She has a male dog of 15 months and we only have one testicle that has descended. The other one is still up. Can I do something to have it come down? Well, we have a booklet, Terry. We have a booklet in Dr. Brian McLaren's information pack for dogs. You have a booklet that's called Undescended Testicles.
Right.
So have you ever done that? Have you ever?
I haven't, because most of the time, if they're a breeding animal, they don't want to breed them because that's passed on. I haven't. I know Dr. McLaren told me he's done it quite a number of times with dogs and horses, said it works. So yeah, definitely give it a whirl. But yeah, he's got the formula there, standard points plus the ones he recommends for that.
Yes, absolutely. And it's still a young dog, so absolutely.
It can take up to 2 years sometimes.
Yeah, he's 15 months. He's still a young dog. Absolutely. Well, I think we are on the hour. I think this was an amazing way to start our first meeting with Dr. Terry Wood. And for sure, I'm looking forward to repeating this in the future.
Yeah, sounds great to me. I had a great time. Hope everybody else did.
Oh, I see something still coming in. Kim is saying the vet wants to perform knee surgery. I started rehab and torch, but the other leg just went. I think, Kim, that the best thing you can do is maybe send an email with more information. And we will answer you. You have also Dr. Terry Wood's email now. You can send him a message and ask him for help. Maybe you live in the neighborhood and you can go and visit Dr. Wood. I see people saying thank you. Thank you, Terry Wood. Thank you. We need more vets like Dr. Terry. Absolutely. And I am happy for all of you who were present here. I would say that let it know. If you've been using Advanced Photonic Therapy, let it know to your friends, to your family, to other people who have pets. If you are in a Facebook group, like, for example, dogs with arthritis or any other pet group, let them know if you see a pet suffering. Because you know what I always say? It's not about sales here. But if you would have a pet that's in pain, wouldn't you want other people telling you about possible solutions? And certainly, if you have been using Advanced Photonic Therapy, you know how it can do miracles. I would just say share that with other people. Share your experiences. Share them with me. I'm about to make a new ebook. Well, just expand it. Share, send me your stories. Send me a picture with your stories. People want to know about it. It's all together. It's like vets like Dr. Terry Wood. And it's like people here, present, who have been using it. We all can make a better world with less suffering. Nobody wants to see their pets suffer. So share the information with others. And together we can make that better world. Okay, Clarissa, this was an hour well spent. Thank you so much. Thank you, everybody. And we'll see you again somewhere in January. It's almost Thanksgiving. Have an amazing time with your family and your friends. And then it's December, a very busy month for many of you. So we'll see you in January 2026. Until then, take care of yourselves and take care of your pets. Goodbye, everybody.
Bye-bye.